I'm Dr. Fakir Averi, and this is Drug-Drug Interaction. The first learning objective is given a patient's list of drugs, identify significant drug-drug interactions. So what can cause drug interactions? In general, drug interactions can be divided into two categories of pharmacokinetic and pharmacodynamic. In general, pharmacokinetic refers to what the body does to the drug. And in general, we're talking about four things. So absorption of the drug, distribution of the drug throughout the body, metabolism of the drug by the body, and excretion or elimination of the drug by the body. Now, of course, when it comes to absorption, we typically are referring to oral medication. So when a drug is taken orally, it needs to actually be absorbed by the body to be available in circulation in the blood and go throughout the body. You can also have the concept of absorption when it comes to other routes of administration, such as subcutaneous, intramuscular, and other routes of administration. It's only when you administer the drug intravenously, for example, that it's 100% bioavailable because you're directly injecting into the blood. But interactions can actually interfere with absorption. So, for example, things such as other drugs can interfere with absorption of the drug in the GI tract. Also, sometimes food plays an important role. So some drugs need to be taken on an empty stomach, and other drugs, for example, must be taken with food, and those are things that affect absorption. So those are absorption. And then distribution refers to the fact that once the drug is in circulation, it actually needs to go to the site of action. So for example, if you're taking a drug to help with the disease of the lung, once the drug is absorbed and it's in the blood, it actually needs to be distributed into the lung. Or if you're taking a drug for a disease of the liver, once it's absorbed and it's in the blood, it actually needs to be distributed into the liver. And there are pharmacokinetic parameters that basically define distribution, such as protein binding and volume of distribution, which you will learn in your pharmacokinetic class. And then once the drug is distributed throughout the body, of course, it cannot stay there forever. So the body actually needs to metabolize it. Now, metabolism can actually happen in the blood for some drugs, but many drugs are actually metabolized in the liver. So the liver, as you know, has the function of detoxifying the body. So one of the things that it does is that it actually metabolizes a lot of the drugs. And I'll talk more about that shortly. And then eventually the body needs to excrete or eliminate the drug. So of course, not every drug is metabolized. So some drugs that are not metabolized, they will be excreted unchanged. So either through the urine or through the feces, it will be excreted. And of course, drugs that are metabolized, they will have byproducts. So those byproducts still need to exit the body. So they're excreted, again, either through the urine or through the feces. So those are pharmacokinetic interactions. There are also pharmacodynamic interactions. In general, pharmacodynamics refers to the action of the drug. So it's actually what the drug does to the body. And these interactions could be additive. So imagine that you have two drugs for lowering blood pressure. So if you take each drug separately, they will lower the blood pressure. Now, if you were to take both of those drugs at the same time, now you have two drugs that lower blood pressure, which would have additive effects. So now you will have a larger effect on lowering blood pressure. So that would be an additive interaction, which sometimes may not necessarily be a bad thing. At other times, it could be a bad thing if you're lowering the blood pressure too much. Sometimes it is needed if one drug is not effective for some patients, so we do need the additive effect, but we want to make sure that that's what we want and it's not a drug interaction causing harm. Another type is synergy. So imagine a drug that alone doesn't do anything, and there is another drug that actually does something. When you take them together, the drug that wasn't really doing anything will potentiate the other drug. That would be an example of a synergy where one drug was not really doing anything, but taken with another drug, it would potentiate the effect of that second drug. And this concept could actually do the opposite thing, which would be antagonism. So if a drug actually antagonizes or reduces the potency of another drug. Now, this course is an introduction, or I should say this class is an introduction to drug interaction. So we're not going to cover all of these. We will focus on some examples of drug interactions with absorption and metabolism. And throughout the rest of your pharmacy education, as you learn about different disease states, you will actually learn about all these possible drug interactions that are significant over the next 2 to 3 years of your pharmacy education. Now, the liver metabolizes many drugs, and the primary system in the liver that helps with metabolism is the human cytochrome P450 isoenzymes. So the cytochrome P450 has a lot of different enzymes. So these are referred to as isoenzyme, and there are a lot of them, but not all of them are clinically significant. So you can see that as a rough estimate, about 36% of drugs are metabolized by CYP3A4. Now, you don't really need to know these numbers. I'm just trying to show you which of these isoenzymes are more important to have on your radar. So as you learn about drugs throughout your pharmacy education, you kind of keep an eye out for like CYP3A4. So these 5 common ones are CYP3A4-5. The second one is CYP2D6 and 2C89. 2C19 and 1A2. So these 5 enzymes are clinically important to have on your radar. Now, some drugs are substrates, which means that they actually have affinity to bind to these enzymes, and then these enzymes will actually break them down, which you have likely learned about these in your biochemistry classes. Now, so other drugs can actually inhibit some of these enzymes, and that can actually cause interaction because it will inhibit metabolism of other drugs that were substrates of that same enzyme. Other drugs can actually induce the production of these enzymes, which of course can actually induce metabolism of other drugs that are substrate. So in general, you have 3 concepts to keep in mind. Drugs are either just substrates. So if they're substrates, they're not really inhibiting or inducing. If they're inhibiting, they actually block its function, so it doesn't metabolize other drugs. If it's inducing, it's actually signaling the body to produce more of these enzymes, so it can actually increase metabolism of other drugs. And of course, keep in mind that not every drug is metabolized by this system. So how do you identify drug interactions? Because that's our primary goal in this class, to actually catch these drug interactions. So the 2 things that we're going to focus in this class is we're going to use some tools to run drug interaction checks. We're also going to look at prescribing information, which commonly is referred to as package insert, which these are actually approved by the FDA. So we're going to use these 2 tools to look for drug interactions. And then, as you advance through your pharmacy education, for example, in your second year of pharmacy education, you will learn about clinical practice guidelines, which will have recommendations on how to manage, how to identify and manage drug interactions. And of course, you can use medical literature. So you can actually look for specific studies in the medical literature to support management of drug interactions. Now, let's take a look at some of the tools that we're going to use in this class. So if you go to one.lluh.org, and this works if you are on campus Wi-Fi, so you will have immediate access to the resources of the university. So you go to this website, one.lluh.org, and then you want to go under Apps tab, and then you go and find clinical desktops, which is actually the first one. So you click on clinical desktop, and it will have a series of clinical tools for you. And then you want to scroll down to go under point of care tools, and then you will have 2 tools that will help with drug interaction. So one is Macromedics and the other one is lexi-comp. So if you click on the lexi-comp icon, it will take you to lexi-comp, and then once you're at lexi-comp website, you can click on interactions, and then it will allow you to add drugs. So if you want to see if multiple drugs interact with each other, all you have to do is just type them here. So for example, I'm going to type Zocor So it will then you click it, it will add to the list here, and then I will say something like Atripla. So I'm just typing random drugs. So you may not know these drugs. All I'm doing is just type random drugs. You don't have to know these drugs. You can do this with any drug. I'm gonna type metformin. Okay, so I have added 3 drugs right now. You can add as many drugs as you want, and sometimes you can even add allergies here. And then once you have all the drugs that you want to check, then you click on analyze, and it will basically run the report for you. And it will say that since we didn't put any allergies, it didn't find any drug allergy interactions, but for the drug-drug interactions, it found that 2 of these drugs actually interact. So Atripla and the Zocor. So it is actually showing you the generic names for the 2 brand names that I put there. And it's saying that this is a type C interaction. And they have the legend here that says if it's A, it's no-known interaction. B, they may interact, but it's not significant, so no action needed. Now with C, it might be significant, but you don't really need to do anything about it. You just need to monitor to make sure that everything, the patient is tolerating the adverse effects. And then if you get D, it would, they're asking you to consider a therapy modification. And the reason they say consider, so sometimes it may not, depending on what you're actually treating, you may not have alternative options. So you may have no choice but to go ahead. But other times you may actually have alternative options to treat the patient. So when they say consider a therapy modification, they basically mean, so use an alternative if you have it. But if you don't, it's okay to continue. And of course, when you get this red X, that's when you want to avoid it. So that would be considered contraindication. Now, in this case, with the interaction between Atripla and Zocor, it's C. So we don't really need to do anything. We just need to monitor. And if you click on it, it actually gives a summary of the evidence of what the actual interaction is. And it will discuss the evidence from other studies that are published. And they will give you references to the studies that were cited here. So that's lexi-comp. Now let's take a look at Macromedics. So if you go back to the clinical desktop, under point of care tools, you can also click on Macromedics, and you just click on Macromedics logo here, and you can see that they also have drug interactions tab. So you click on it, and it works basically the same way. So if I type Atripla here, you just click on this arrow to add it to your list. And then I also had Zocor, you add it to the list. And the last one I had was metformin. So there are different formulations of metformin. Some of them are in combination. I'm just gonna click on the first one. And then once you're, you can add as many as you want. But once you're happy with your list, you just click submit and it will analyze it for you. And Macromedics uses a different nomenclature for identifying the drug interaction. So they classify based on severity. So either moderate, major, or minor. So you can see they also show you drug food interaction. They show you drug alcohol interaction or ethanol interaction. And of course, we want the drug interaction. So if you go to the top, so the first thing they listed was the drug-drug interaction. So they show you that the Atripla was efavirenz and simvastatin was the Zocor are interacting, and they're saying that it's moderate. And if you click on moderate, it will open a legend, so it shows you what that actually means, which means that the interaction may result in exacerbation of patient's condition and or require an alteration in therapy. Now, note that with the nomenclature in Macromedics, is this symbol that says contraindication when you actually want to avoid it. Now let's take a look at package inserts. So package inserts are FDA approved. There are different ways of getting the latest package inserts. Of course, if you're in the pharmacy, every bottle of medication has the package insert folded and attached to it. So that's one way to get it. You can also get it from the manufacturer's website. So if you know for example, Genvoya is a relatively new HIV drug. If you just go to their website, you can get the PDF of a package insert. You can also get it from the FDA website. My favorite way of getting it is from the Daily Med. So Daily Med is a government website, which means that you can access it for free. You do not have to pay for it. It's always up to date. As long as the government is not shut down. The only time I've seen this get outdated is when the government is shut down for political reasons. Then nobody will update it. But other times, having government shut down is relatively rare. So you just go to this website, and then so you basically can search. They have both human and animal drugs, so I recommend to help you better or more efficiently find your drug to click on human drugs. Let's use the example of ATRIPLA. So if I type ATRIPLA, it will show up. And then you might see multiple listings. I recommend that you actually click on list repackage labels last, and then what shows up at the top is the actual package insert. So I'm just gonna click on the first one, and it takes you, so here's the package insert in different sections, and if you wanted, you can also click to get a PDF of it, so it's easier to read or print if you wanted to. But what we are looking for is drug interaction. So if you go to section 7 in this examples, you see drug interactions. You click on it, it will expand. First of all, it will talk about how this drug is, found to be behaving in respect to different CYP enzymes. So it shows you different CYP enzymes, and then it goes over the actual drug interactions. So in fact, they give you a comprehensive table of all the drug interactions that have been studied, and they tell you what the drug interaction is and what it does, and it gives you commentary. So you can actually, if a drug that you're dispensing to a patient, or oftentimes you will get a patient ask you, oh, does this drug interact with anything? So then, with no other medications in hand to check. So if they're just asking you in general what are some drug interactions, then you can't really run a drug check on Macromedics because you don't have any drug, and you don't want to type every possible drug in Macromedics. So this would be a good place to go because they have listed pretty much all the known possibilities at the time that they submitted the drug to FDA, and then you can decide which one is significant to discuss with your patient. I'm going to go back. You can also use from the main page, you can also use the advanced search. So because sometimes if you get too many in there, it becomes difficult to find what you're looking for. So if you go to advanced search, you can click on human drugs again. And then from the criteria, I recommend using drug name. And then you type, let's say, metformin in this example. And then you click search or add, and then the results show up, and again you can just click on the drug that you're looking for, and it will have the package insert. The next learning objective is given a patient list of drugs, identify significant drug-food interactions. So as I mentioned before, a lot of interactions involve absorption of oral medications. Now, for the most part, a lot of drugs can be taken regardless of food, so either with or without food. However, some drugs have to be taken on empty stomach because the food can either reduce or, for some drugs, increase the absorption. So if it's reducing it, it will result in suboptimal dose, and if it increases it, it will actually result in toxicity. The same is true with food. So some drugs need to be taken with food. And then specifically when it comes to absorption, some drugs need an acidic environment. So if someone, for example, has a heartburn or GERD and they need to be on acid suppression agent, then they, that will interact with that drug's absorption. So sometimes you can actually separate the antacids, or sometimes it's actually contraindicated. So that's another interaction with absorption. And of course, when it comes to drug metabolism, some foods can also interact, including some of the over-the-counter supplements. So some of the most common ones that you absolutely need to know is that grapefruit is actually an inhibitor of CYP3A4. So remember, CYP3A4 is the most common CYP enzyme that metabolizes drugs. So that's a fruit that will interact with any drug that's a substrate of 3A4. And over-the-counter supplement is St. John's wort, which is an inducer of C3A4. So these two do the opposite thing. Another thing that people don't often think about is that tobacco smoking also induces CYP1A. So CYP1A was one of those type 5 CYP enzymes. So these are important to know because these three, usually patients don't think about drug interactions. So they may just give you a list of other prescription drugs, but you should always ask them about these. Now let's take a look at lexi-comp to see how to find food interaction. So once you're at the homepage of lexi-comp, all you have to do is search for a drug. So I'm gonna type AAA here. So once you go to AAA's page, I'm just gonna click on the first one here. You want to look for administration and storage, and then when you open it, it's gonna have a section for oral administration, and then it will tell you how to administer it orally. So it will say administer on empty stomach. So that's how you would know that this drug must be taken on empty stomach. So when you talk to your patient and provide education to them, you're going to tell them that you have to take this on empty stomach. Do not take it with food. You can get the same information in Macromedics. So if you go to the homepage of Macromedics, all you have to do is search for your drug. So in this case, AAA. And then once I'm just going to click on the first one. And then once you're in there, you look for administration. So when you click on administration, it's going to talk about food. So take on empty stomach. And it gives you a reference of why they're making that claim. The last learning objective is given a patient case, evaluate patient's response to treatment to identify drug interactions. Now, for every disease state that you're treating in your patient, there should be a goal of therapy. And we would like the patient to be at goal. And that's how you know if the treatment is effective. Now, if there is a lack of efficacy, this could be due to suboptimal exposure to the drug. So imagine you want someone who has a high blood pressure and you would like them to be at goal blood pressure, but they haven't been able to achieve that. It could be because their blood pressure medications are suboptimal. And this could be due to many reasons. So you need to actually evaluate the patient. So when you look at the patient case, first you need to identify if the patient is at goal or not. Because if they're at goal, then you don't have to worry about it. They're at goal. It's when they're not at goal, you need to investigate to see what's the underlying cause. Now, of course, it's not immediately apparent what the underlying cause is, so you need to start probing and ask questions. So you want to ask open-ended questions. Ask the patient how many doses have they missed, as opposed to asking closed-ended questions. So you don't ask do you miss your doses. That's a yes or no. So the patients are likely to say no without thinking about it. But if you ask, how many times do you miss your dose? First they have to think, and then they say, well, wait a minute, I didn't miss any. So it's always better to ask open-ended questions. So you check for adherence. So if they've been taking the adherence, and then you want to check for drug interactions. And you ask them if they've been taking anything over the counter, any new prescriptions that you don't know about, other herbal supplements, things like that, including changes in diet. So that's to identify causes of suboptimal. And of course, if you don't find any cause and there's no drug interaction, it could be that you either need to change the drug or you need to increase the dose. If you're already at the maximum dose, you may need to change the drug or add another drug on top of the current therapy. This all depends on the disease state that you're managing. I'm giving you general points and tips. Now, when it comes to toxicity, so that now for safety, it's important to evaluate that the patient is actually tolerating the drug. So even if the patient is at goal, you need to make sure that they're tolerating it. Because if they're at goal but they're vomiting all the time, that may not be a good thing. So you want to evaluate. Some adverse effects are expected, so it's not necessarily toxicity. So a little nausea here and there might be expected. But sometimes there could be unexpected, so unnecessary and excessive diarrhea, for example, is usually due to toxicity. So first, you want to make sure that the patient didn't accidentally overdose, and you want to make sure that there wasn't a medical error that accidentally gave too high of a dose. And then once you look at all of that, then you also want to make sure there's no drug-drug interaction. So you do the same thing. You want to ask them if there were any new prescriptions that you don't know about, any over-the-counter drugs, any herbal supplements, any changes in diet. Did they start smoking or use on any other illicit drugs? So those are the things that you use as part of your clinical reasoning to identify and catch drug interactions. And then you have a better idea of how to manage those drug interactions. And the ultimate goal is to improve the efficacy and safety of patients' treatment. This concludes this presentation.